Hello and good afternoon. This is Dr. Yuvraaj Singh. I'm heading the Departments of Medicine and Critical Care at Supreme Hospital, Jammu Village. Today, I want to discuss a rather important topic, and this is about gastrointestinal symptoms and complications due to COVID infection. We all know that COVID has been the greatest pandemic since the Spanish flu in 1918, with devastating consequences becoming one of the greatest public health issues worldwide today. We also know that it primarily affects the respiratory system, but it can also have extrapulmonary symptoms and complications as well, especially affecting the gastrointestinal or the GI system. I'd like to discuss some of the points of this topic under certain headings, such as the first one being the route and modes of entry. This is a very important thing because this will also lead to how you take measures towards prevention. The routes of entry is generally through the mouth, wherein you take in contaminated food and water. How does your food and water get contaminated is the first question one might ask. So generally, given the fact that it's the monsoon seasons right now and the faulty sewage systems, plus there's human and animal defecation going on, all of this seeps into the soil, is collected into the water reservoirs. Although the water we drink and the water we consume may be highly and thoroughly sanitized or disinfected, but there are some viable microorganisms and cysts which remain inside the water and can be transmitted, viable enough to cause infection later on. The other is the fecal-oral route, wherein if somebody passes stools or defecates and does not wash his hands properly and does not sanitize himself properly, the next time he's consuming food with his own hands, it can be transmitted through that as well. The other way the virus can enter into the GI system is by way of the lungs or sputum. If somebody is infected inside the lungs with the virus, and some people have a habit of swallowing their own sputum rather than throwing it out, which is again a bad practice. So if the viral load is high, it may go inside the GI system and it may cause infection there. Another way is by way of fomites. Fomites are inanimate objects which are just lying around normally inside somebody's home. And generally, children have a habit of putting them in their mouths. And there are so many articles lying around, we touch them all the time, and then we just, maybe consume food or eat something without washing our hands. So these are ways that the infection or the virus can spread into the GI system and cause infection, substantial infection. Now I'd like to talk about the mechanism of how this infection happens. So once the virus has gained entry into the GI system, it could be because of, although there are natural barriers provided when there's hydrochloric acid within the stomach, which may try and kill some of these microbes, but if the viral load is too high or if the rate of replication of these viruses is very high, it may pass into the further along into the GI tracts and cause infection of the cells. Research has shown and established so far that there are certain receptors, the ACE2 receptor or the angiotensin converting enzyme 2 receptor, which is responsible for binding the virus and internalizing it into the cells. That is how the cell gets infected. The GI system is lined by enterocytes, which highly express these ACE2 receptors, in fact. And the viruses bind to this, and these receptors then facilitate the entry of the virus into the cell. And then there's the viral subgenomic mRNA, which enters the cell, and then there's replication, and these cells get infected. Now, we know one thing is that generally during the monsoons, there's a lot of contamination of water and food, and especially in India, where street vendors are catering to a large number of people. These people are not very particular about their sanitary practices or hygiene. So the food, they're your primary handlers out there. When you eat food on the streets, they are handling your food. And we don't know how much of sanitation they practice. But when they are handling your food, they may be transmitting a lot of microorganisms along with the coronavirus into your food, which you're then consuming. You may get infected by that. The sewage system in India is still not the best. We have faulty sewer systems. There's a lot of seepage of dirt and microorganisms into the soil. There are underground vegetables. There's water going into the reservoirs. Cleansing may not happen to full scale. There are certain viable cysts and microorganisms, like I mentioned earlier, that may survive and you may consume them. I'd like to talk about the symptoms now. Symptoms may vary from mild to moderate to severe symptoms, which may further lead to complications. You can start with just anorexia, which is loss of appetite. There may be nausea, diarrhea, vomiting. There may be prolonged diarrhea sometimes. In patients, we've observed that patients have diarrhea on and off for a couple of weeks to even a month. This could be osmotic diarrhea, not necessarily infective, but nevertheless, it does lead to serious consequences if not treated early, because dehydration is another detrimental effect that can happen on the body. The other organs that are affected in the GI system are the liver, gallbladder, pancreas. We have seen transaminitis or inflammation of the liver, liver cells, when there's increase in the liver enzymes. There's a gross raise in the liver enzymes leading to what we generally term as hepatitis or maybe infection-associated hepatitis. There can be acute cholecystitis, which is inflammation of the gallbladder. There can be acute pancreatitis as well. And on the other end of the spectrum, there are certain serious conditions that may arise because of the infection, which is intestinal obstruction. There can be ileus, wherein the natural motility or peristaltic movements of the gut are completely stopped. There's accumulation of harmful gases and fecal matter inside the intestine, and that leads to detrimental effects later on. There can be mesenteric ischemia, which is clotting of the blood vessels which are supplying the gut and the mesentery. These could lead to gangrenous complications, which could be very, very serious. All of these conditions generally cause a lot of inflammation. There are a lot of inflammatory mediators released into the blood. Specifically from the GI is interleukin 18, which has been detected in stool as well. So once these inflammatory mediators are circulating inside the blood, they may lead to involvement of other organ systems as well, which later can lead to profound, multi-organ dysfunction as well in certain severe cases. How is COVID detected in the GI system? GI COVID can be detected by way of detection of infected cells in stool, because generally live viruses may not be shed in stool, but the virus infected cells are shed in stool. I'm asked a question, what is the incubation period for COVID-19? Well, the incubation period basically means from the time between exposure to the onset of symptoms. It could be anything between 4 to 14 days. But generally, there's a mean period of 4 to 7 days when symptoms may appear, but it may go on to 14 days as well. Which organs are most affected by COVID-19? It is primarily the lungs or the respiratory tract and the sinuses, throat, the respiratory system, but the GI system as well. We're seeing a lot of GI COVID cases right now. Divya asked, Gopichand asks, what should someone who's experiencing post-COVID syndrome do? Well, somebody who's recovered from a COVID infection should first take good amounts of rest. Do not exert too much, because there are cardiological effects as well, along with the respiratory ones. Drink lots of water, and in moderation, once you start feeling better, start doing your exercises, tolerance exercises, breathing exercises. Antrix asks, can the COVID-19 virus survive in drinking water? Yes, well, the virus can survive anywhere in any medium for at least up to, say, 1 to 2 days. But there have been specimen and cases seen where it survived up to 96 hours as well. That's almost 4 days. What is the link between COVID-19 and gastrointestinal infection? Well, there are two hypotheses postulated so far as to how COVID-19, somebody who's infected through the lungs, can exhibit gastrointestinal symptoms as well, is because of something known as the cytokine storm, or these cytokine mediators, inflammatory mediators which are circulating in the blood, can also cause GI symptoms. Second is through direct ingestion of the virus causing infection in the GI directly, GI system. Who are at higher risk of developing serious illness from COVID-19? Well, there are generally patients with people with comorbidities who are diabetics, hypertension, and people who have organ failure states or immunocompromised states. They're at a higher risk of developing serious illness from COVID-19. Raja asks, what are the clinical presentation and natural history of COVID-19? Well, COVID, once somebody is exposed to the virus, there's an incubation period, and he may start showing symptoms out anytime between 4 to 14 days of exposure. And then there are symptoms depending on the individual's immune status. It may be a mild or to a moderate to a severe kind of a condition, wherein there's cold, cough, there might be breathlessness, and then it can be more severe as to complete pulmonary edema and things like that, which may lead to ventilation also. There are GI symptoms as well, loose motions. Why most of the people are now facing stomach ailments post-COVID-19? Well, one is through direct infection into the GI system, which is by consuming contaminated food and water. And the second is via these inflammatory mediators. If somebody is affected in the lungs, these inflammatory mediators lead to inflammation of the GI tract as well, leading to these symptoms. Does COVID affects badly in our GI system? Yes, some people have come to us with mesenteric ischemia as well due to COVID and intestinal obstruction, wherein there's gangrene of the gut, and it has had to be surgically excised. And so these people do face tremendous challenges. There can be acute pancreatitis, acute cholecystitis because of the virus as well. And these are serious conditions. How is SARS-CoV transmitted? Well, the mode of transmission so far as we know is through aerosols, wherein the virus is suspended in the air, and if somebody's transmitting or is a carrier or has been infected and shedding the virus, we can contract that via breathing, just breathing, because the virus is suspended in the air in the form of aerosols. That's one way, and the GI can be infected by consuming contaminated food and water. Parna Sharma asks, the coming Delta Plus variant is also dangerous as earlier ones. Well, it depends. There are many factors which may decide how dangerous a particular variant is. In particular, the number one thing is transmissibility and the kind of detrimental changes that it might cause, the virulence and pathogenicity of the virus. These are factors. The host immune status is also a big factor. People, if their immunity is low, they may face serious challenges, while people with good immunity may not as well. Divya already asks, how long is the recovery period from GI complications post-COVID? Well, we've seen people who've had just maybe, isolated events of maybe a diarrhea or vomiting, nausea. Some people have the prolonged form wherein there's nausea, extending up to even a month. And some people have diarrhea even up to a month. I personally have seen such people. And they do get all right with treatment, but then these symptoms do occur. Aryan asks, how does waking up early in the morning impact our mental and physical body, both positively and negatively? Well, the morning, as we know, the body works through a circadian rhythm. There are diurnal variations in the physiology of the body. In the morning hours, generally, there's a good load of secretion of hormones, which follows the sun and moon pattern as well. So when you wake up in the morning, your body is ready for activity, your sympathetic system kicks in, everything is in order, and the mind and the body knows that you're now going to perform certain activities through the day. But if you're staying up in the night, your body is going to be stressed because it's not built in that manner. It's not built to take the stresses of the night, because there's a lot of hormonal and enzymatic changes inside the body during these times. Ashish asks, vaccination also is required after every year? Well, we don't know that yet, honestly, but the fact that when you're vaccinated with the COVID vaccine, 2 doses at least should provide sufficient protection, as research now shows. But that's only a matter of time. We have to wait for a certain amount of time to be able to ascertain with affirmation that it will not be required every year. It should not be. Hopefully not. Parna asks, how safe are people who already had COVID? How long immunity remains to fight virus? Well, research has also shown that people who've been infected by the COVID virus, the coronavirus, have had, so there's, in the immune system, there's something known as B cells or memory cells, which are inside the lymph nodes. So once you've been infected, these memory cells, they remember what causative agent caused that infection. And the B cells or the memory cells have been seen to be active up to about 8 months so far in patients, 8 to 12 months. So hopefully it should go beyond that. Aryan again asks my question, how can I increase my productivity at work? Are there any exercises or practices that I can employ? Well, productivity at work is basically, if it does not require a lot of physical involvement, like something that you have to do manually, if it's just your mind, but you have to sit for long hours, you have to take care of your body first. Your body has to be able to be in a condition to take those long hours of work. So there are exercises, breathing exercises. There are general freehand exercises that you can do every day. Eat right, stay light, drink lots of fluids. These things will help. Gopi Chand asks, how long does it take to develop an adequate immune response after receiving the COVID-19 vaccine? Well, generally, when you take both the doses, it takes about 2 to 3, anything between 2 to 3 weeks for your body to develop an adequate immune response. After the first dose, the body does receive the virus and is already generating antibodies against it. But for a complete immune response or complete immunity to develop will take at least 2 to 3 weeks after the second dose. Raja asks, what are some of the important SARS-CoV-2 variants? Well, the WHO has classified these variants into 2 types based on variants of interest. There are variants of interest and variants of concern. So based on the transmissibility and the detrimental changes that the variant can cause in people, the virulence and the severity of the disease, and also depending on the decreased effectiveness of public health and social measures. They're divided into variants of interest and variants of concern. So the variants of concern are the alpha, beta, gamma, and delta variants, which have actually caused a lot of havoc here in the last 1.5 years. And the variants of interest, which are not very, virulent or pathogenic, they are eta, iota, lambda, and kappa. So these are the variants that have been isolated so far. Post-vaccination, what precautions are needed if the wave hits? See, precautions generally, so far that we've learned, is your social distancing measures, wearing your masks at all times, especially when you're in public, practicing sanitizing measures, washing your hands properly, especially in case of GI COVID. To prevent GI COVID, do not consume food from outside or vendors, or if you don't know the source of your food is authentic, do not consume it. Wash it properly when you bring it at home. Cut your nails so that there's no dirt or germs under your nails. Wash your hands properly before every meal or before you put your hand to the mouth at any point in time. Wash your hands properly. These are some of the measures that you can employ to take precaution. Joginder asks how to manage digestive and gastrointestinal health after COVID recovery. Well, one should first and foremost one should drink lots of water. Make sure you drink a lot of fluids, be it juices or just water or coconut water, to hydrate yourself well. Hydration is very, very important. Second is make sure you practice sanitary measures very, very carefully and properly. Cut your nails, wash your hands every time. Make sure even your food handlers, people who are handling your food, who are making your food, make sure their nails are cut, their hands are washed, all your utensils are washed and cleaned properly, all your vegetables and fruits are washed thoroughly, and your food is cooked properly. If it's improperly cooked, you might contract a lot of GI diseases from there. So make sure all these measures are, taken care of. Ashish asks, people are saying Sputnik is better than Covishield. Is that so? Well, honestly, I've been seeing a lot of people who've been taking Covishield, and it does have a lot of, it has a good effect in all the people that I'm seeing so far. I honestly have not personally seen people who've come after Sputnik, and I don't know what the effects of that are or how much immunity does it provide. But Covishield I can vouch for, yes. Well, Supreme Hospital is in Chambor village. It's in Surajkund, which is Faridabad. Supreme Hospital is in Chambor village, Faridabad, as I said, sorry. Thank you.